The opioid pandemic is something that is happening right now in the United States, and it's due to the prescription drug opioids. So right now, not only has this drug become widely available, but it's also a street drug. Some of the contributing factors that have led to the opioid crisis is definitely the overprescribing of opioids by either physicians or other healthcare providers who are prescribers, as well as when patients who may not have their pain controlled well enough begin to take the medication not as directed. So, for example, if a patient is only supposed to take a hydrocodone pill twice a day because the patient's pain is not being managed, they may end up taking more and increase to 4 times a day. And because opioids are very powerful drugs, this creates the perfect recipe for addiction. It crosses all racial barriers, it crosses all economic statuses, all social statuses. So anyone can be affected, whether it's a person in the neighborhood or a person who sits on a bench or even physicians themselves. So this thing is very dangerous and important for us to get a control of, because it doesn't matter. Anyone can be potentially affected by this. Fentanyl is one of the more powerful opioid drugs. In fact, pure fentanyl in its form only requires a little bit to cause massive damages. There have been cases where sheriff's officers or even ambulance personnel have come in contact with residuals of fentanyl, and they've had to be revived with Narcan, which is what's used as an antagonist or something to block the effects of opioids. And this Narcan is commonly found in different workplaces. You can find it at pharmacies, different healthcare centers, and this is also available to family members who may have a family member that is struggling with addiction. If they feel that the person is in danger of having an opioid overdose, they can themselves purchase the Narcan just to have it on hand. When a person is experiencing an overdose, you can usually tell by the following symptoms. Their fingertips or either their extremities will turn a bluish purple. Also, the person can lose consciousness. They can have labored breathing or slow breathing, or the breathing can completely stop. If you feel their face, it will feel a little bit clammy. So those are some of the signs and symptoms to look for. So I think the number one thing that will help combat this opioid epidemic is each one of us needs to start thinking of ourselves as first responders. So number one, if there is Narcan available, then of course treat the person with Narcan, but then you also need to call 911 immediately. So get the person help as soon as possible. There are several hospital detox centers, and so what normally happens is a patient is admitted to the detox center, and depending on the hospital, they usually stay for 2 or 3 days, and then they are then referred to a long-term detox center, a long-term rehab center, and then these can last from anywhere from 2 weeks up to months. It just depends on the needs of the patient, the family members, and what type of intensive treatment that the patient needs, or if they don't need intensive treatment. So it's all dependent on the patient and what's best for their family and situation. Almost with any type of addiction, there's an underlying problem, and people like to treat the problem in ways that they feel are appropriate, whether it's opioids, other drugs like cocaine, or whether it's alcohol. People will try to mask and cover up pain and symptoms. So with a mental health professional, they can get to the root of the problem and actually have the patient face whatever pain or whatever instances that they've been having, whether it's depression or anxiety or anything. They can help these patients come to terms with whatever issues they're facing, and if they can't, they can reach out to psychiatrists or other health professionals that can help these individuals. G Health offers plenty of resources. We have access to mental health officials. We have access to rehab facilities and all of those facilities that we can make a recommendation for our patients or for anyone who's actually looking for help. We have access to a number of great resources that would be of good assistance and good help. All you have to do is come down and ask, and we can refer you to the right person. And if they don't have the resource, they'll refer you to the right person. So a lot of resources for patients and people in this community.